obvious example of real life impact that research has had for me is that when I was 19, I had a genetic test that identified me as being a very high risk of developing breast and ovarian cancer from the BRCA1 gene alteration. And that was only really identified in the late 90s by Professor Mary Claire King. So without that research, that medical and health research, I wouldn't know that I'm at high risk. And without that knowledge, I wouldn't be able to go and take the preventative measures that I will be taking in the coming years. So it's had a very, very definite impact on the trajectory of my life and hopefully being able to avoid having a cancer diagnosis.
Well, I owe my life to health research. It's because of gene sequencing and gene tracking that for a rare virulent form of cancer that was in a niche population, very specific niche population, it's because of that I'm alive. Because it meant that I was able to have preemptive surgery. And so I didn't die in my 40s or 50s like my mother and my grandmother. My cousin didn't do the test, did get the cancer, and did die. So from my perspective, there's something here also about building trust with the public about health research as much as building trust in the public for health researchers.
The impact research had in my life is quite clear. I had throat cancer. The best evidence-based treatment at that time was a voice box removal. But because my clinicians, a surgeon and an oncologist, brought me into the discussion and chatted about it, what we came to the conclusion, what I came to as a conclusion was, it's when we look at research, we apply all the evidence and think about it, and then we look at the patient in front of us. And then the third aspect is when our clinicians use their experience, their day-to-day work and observations to decide what is best for the patient in front of them. Personally, at the time, I was sure I would have my voice box removed. They said they thought they could do it with radiotherapy. 27 years on, I'm still here.
Research into lobular breast cancer has had a profound effect on my life because when I was diagnosed, there was very little information there. But having got involved in research as a patient partner, I now know that my subtype, which is invasive lobular breast cancer.
It keeps us alive. It makes us feel valued. It makes us feel useful. It makes us feel, want to contribute more. And like when you're involved in a research project, I've been involved in a couple where I'm co-author. You're trying to think yourself, how can we make this research project better? Which means you're stimulating your brain more. There is no downside to this.
I was diagnosed with breast cancer in early 2018, and it was an early stage diagnosis. And I was told that the treatment would be quick and not too aggressive and would be over in 2 to 3 months. However, later I was advised that results had come back on the tumour type, and the team decided they were now going to treat it very aggressively, with the treatment taking the best part of a year. So this treatment regime was obviously based on continuous research and trials of best long-term outcomes of treatments for different breast cancer types. And I felt very lucky to be the beneficiary of all that knowledge built from research.